Chapter 9, Chronic Illness and Rehabilitation. Nursing implications related to chronic illness are to understand that spiritual distress may be experienced as the person is faced with limitations of the illness or disability. Holistic care that addresses the spiritual as well as psychosocial needs and physical needs is required and essential. Powerlessness, especially during the phases of diagnosis and early treatment, is experienced. A chronic illness can dictate much of an individual's life. Support of unusual coping techniques and nurses assisting with learning new ways of coping. A nurse can be instrumental in instilling hope for a good quality of life despite the illness. Note that impairment, disability, and handicap all have their own definitions, but in society we term these as one common definition, and they are used interchangeably. Early effects of decreased mobility include a decrease in muscle strength, generalized weakness, easily fatigued joint stiffness, decreased coordination, abdominal distension, and metabolic changes that are detectable by laboratory testing. The nurse suspects early complications of immobility for a 45-year-old patient admitted with multiple stab wounds to the chest. Which complication would be most likely? Increase in muscle strength, generalized weakness, shortness of breath, limited range of motion, imbalance. The correct answers are 2, 3, 4, and 5. Disease and chronic illness are often used interchangeably. Chronic disease period is lasting longer than 3 months, and it refers to the pathophysiologic process that leads to a medical diagnosis. Certain diseases like diabetes mellitus, hypertension, heart disease, cancer, stroke, can be asthma, multiple sclerosis, musculoskeletal deformities like osteoporosis or arthritis. Patients often have more than one disease process. Chronic illness is extremely broad and it refers to the lived experience of the patient that has the chronic disease process along with their family. The experience is influenced by their perceptions of the illness, age, gender, culture, and socioeconomic status. Planning care for residents in long-term care facility, the licensed practical or licensed vocational nurse must keep in mind the overall goals of care for facility are to provide a safe environment, to assist the resident to maintain or attain functioning, to promote independence, and to allow the resident to maintain or achieve autonomy. Safety is the #1 prevention for any form of nurse. We want to help keep confused individuals appropriated to time, place, and person, and we also try to prevent falls. Restorative programs focus on muscle strengthening and balance. The nurse should assess all medications to determine the risk of medication-induced postural hypotension or dizziness. Chemical restraints are tranquilizers or sedatives that calm the resident and alter the behavior. Physical and chemical restraint use is restricted by law and is applied only as a last resort for safety when a resident is exhibiting a threat to themselves or others. The purpose is to ensure that restraints are used to protect residents. Alternative measures are tried first. When a security device is used, the least amount of restrictive force is chosen. A variety of techniques can help prevent a restraint-free yet safe environment for all residents. All safety devices or restraints must be ordered by a healthcare provider. After careful consideration of less restrictive measures, the nurse decides to apply physical restraints to a confused older man. The nurse must include which measure to ensure safety. Promptly attend to the toileting needs of the patient. Reevaluate use of the restraints every shift. Ensure adequate nutrition and hydration. Administer scheduled doses of sedative or hypnotics. Provide frequent range of motion exercises. The correct answer is 1, 3, 5. The environment may be structured so that the resident has visual reminders of the day, the year, as well as the time. The environmental aids are readable, up-to-date calendars, a clock with large hands and numbers, a local newspaper or television show, radio news. The priority is to maintain safety for the individual. Once a functional assessment has been completed, specific goals should be written to maintain the highest level of functioning possible for the resident. As the population of elderly individuals grows, the need for rehabilitation services will grow as well. Healthy People 2020 goals for rehab are to increase the individuals that are able to function individually in society and not have to have residential needs or support, and they can live on their own. Vocational rehabilitation is job retraining for disabled individuals under the American with Disabilities Act. This allows the individual to have a means of self-support. Rehabilitation is concerned with achieving better quality of life. Many patients that require rehabilitation services are disabled due to a chronic illness. Some individuals become disabled from trauma occurred during an accident. Patients who have had a hip replacement often are placed in a skilled nursing facility for rehabilitation before they return home. Many communities have a hospital that has an outpatient rehabilitation program for individuals with cardiac and respiratory problems. Rehabilitation services are scarce in rural areas, and patients who have sustained neurologic injuries or a loss of musculoskeletal function because of amputation, trauma, or disease often have to go to a rehab center that is miles away from their home. Programs within large cities are often available for vision or hearing rehabilitation. YMCAs often have rehabilitation programs with water exercise for patients that have severe arthritis. Most burn centers have comprehensive rehabilitation programs for the burn patients. Depending on the system that needs rehabilitation, there will be various services offered throughout the individual's environment. The rehabilitation team is the nurse as part of the team, and the patient is the manager of the team. The nurse assists the patient to become an optimal in their level of health and wellness. The nurse assists in ensuring that the patient correctly performs exercises and activities as instructed and reinforces their teaching. A collaborative or interdisciplinary care plan is followed for each member of the team to make them aware of what treatment and education the patient is receiving. Short-term and long-term goals are set with the patient. This helps provide for continuity of care, recognizing the critical importance of each medical discipline in promoting positive outcomes for the patient. A good sense of humor, gentle, firm people skills, patience, and the ability to provide solid encouragement are tools that are necessary for working with rehabilitation patients. The philosophy of rehabilitation in nursing is based on the recognition of the patient's need for independence. Learn to judge when the patient should be allowed to struggle to do something on their own, and learn to recognize when the patient's frustration is reaching a level at which assistance is needed is something the nurse will learn throughout experience. There are two levels of LPNs and LVNs employed in rehab facilities. One does not have intravenous therapy permissions, and the other one has the intravenous therapy permissions and functional independence measure certification. The nurse that has the functional management and IV therapy performs all the same tasks. The LPN or LVN helps keep the patient in line with the goals that are set for the patient to meet, and the nurse will assist the patient in meeting those goals as well as removing any barriers. The LPN or LVN also is a preceptor for an unlicensed assistive personnel. The LPN or LVN carries out all normal patient care duties, provides input and feedback to the patient's care team. The licensed practical or vocational nurse must have 1 year of experience working in an acute care facility before they are hired for home care in most states. Routinely, the LPN or LVN that works in home care is under the supervision of an RN case manager. The LPN or LVN may be providing private duty services for an unconscious patient that needs skilled care like tracheal suctioning or tube feedings, performing home visits to change dressings, monitor blood sugars, or the nurse may be acting as an in-agency supervisor by coordinating home health aide visits and supervising their work. The role of the vocational or practical nurse in home care is growing. The family provides assistance with personal care, and a home health aide may visit a few times a week to bathe the patient and shampoo their hair. Homemaking is provided by family members or by a homemaker aide. Sitters may be hired to attend to the patient's need at night if the family cannot provide the service. Nursing care plans are formulated and consider 24-hour needs in collaboration with the patient and the family. Medicare requires a case conference every 60 days when more than one discipline is involved in the patient's care. Each visit to the patient includes a physical assessment of the identified problems and of nutritional, home safety, elimination, skin, and psychosocial status. All the findings are documented. Between visits, the nurse may contact the patient or the family just to check in on various aspects of care. Some home care agencies have an assessment tool for caregiver stress. When caregiver stress is high, calling this agency's social worker can provide either more help for the caregiver or a respite program that might provide the caregiver with a few days of necessary rest and relaxation. A respite program will provide room, meals, and care for a patient while the caregiver is relieved of all the responsibility.